about us. Think about you.
Hello. What's up, everybody? How's everybody doing? I see Tan Booth is in the building over on Instagram. Thank you for hanging out with us over there. Can you guys hear me okay? D. Lynn, Foxy Moxie, Roel, what's going on? Great to see everybody. I hope everybody is well. Making sure I've got everything set. Okay. We're going to let a few more people come in here. We appreciate y'all spending your Tuesday night. It is Tuesday night. Happy Tuesday, everybody. Let's see here. Okay. Doing this for Instagram. I'm going to pin that. Frida, hello. Tom, my brother, what's going on? My workout today was light. Good evening. Danny, hello. Leanne, hello. Lisa, thank you for sharing as always. Good. Thank you, Tom. How's everybody's week been? I guess it's been a short week so far. We got 24 people in here. We're gonna let more people join us. Thank you, Tan, for hanging out with us this evening. We're taking questions over on Instagram as well. Doc will be in the building very shortly. Let's see. We're gonna let a few more people come in. Jay, hello. Oh, nice. Let me know what you think about the Lumara red light pad. I think we got one back there somewhere. Hot week, yes, Lisa. It is a extremely hot week this week, but we're getting through it. Hopefully, it cools off here shortly this weekend. Let's see. I'm in the Tri-Cities. Anybody going to the Braves game in Bristol? It's kind of an exciting thing here. Going to be the most attended Major League Baseball game in history, I believe. All right. If you guys got a question for Dr. Rogers, go ahead and put it in the comments real quick. I'm going to go over what we have put out this week. As you know, Performance Weekly goes out every single Tuesday at 3 p.m. If you're not signed up, go to performancemedicine.net and sign up. It's where kind of a curation of all of our content goes every Tuesday. And the feature Common Sense episode was this. Finally, redemption for women's hormone therapy. I do not think I have the video that goes along with this. There's a clip from Dr. Makery, who is the author of this book here called Blind Spots. Dr. Makery makes an excellent, let's see here, there we go, an excellent case for women's hormone therapy, debunks a lot of the myths around it that came from the WHI study back in 2002. He addresses that. If you don't know who Dr. Makery is, he's the head of the FDA now. And we're super excited about it. It was I'm sure you guys have seen clips on the internet. It's gone nuts on Instagram, on everywhere. So, but we clipped it at the end of that video. So at the first 5-6 minutes are Dr. Rogers talking about the video. And then the last 3 are the actual video. So I'd encourage everybody to check that out, especially if you have concerns around hormone replacement therapy, which, you know, so many people do. And that's actually one of the reasons we have this show is we want to talk about it. We want to answer questions. And if you have concerns, for those, see, if you need to be concerned, we're going to be honest with you and give you kind of what's actually happening. I see people are coming here. Michelle, what's going on? Melinda, hello. Melissa, hello. Great to see everybody. We're taking live questions over here as well over on Instagram. Thank you guys for being with us this evening. I see you, Melinda. I see you. Ivy and JC with Ivy, what's going on? Happy Tuesday to you. Kathy, I hope Tina comes in and hangs out with us. We're going to be answering all your health and wellness questions tonight. If there's any questions around women's hormone therapy, any questions around Dr. Makery's remarks, any questions around that video in general, we'd love to talk about it. If you know friends who have questions, bring them in. We'd love to see them. And then, of course, we have the star of the show, Robin Riddle, put out a brand new episode of Explains It this week. It is on creatine. And creatine is it's an extremely hot topic right now. And if you watch this video, Robin does a fantastic job of explaining all the benefits, and it's not just muscle. There's so many benefits to creatine. I'm even thinking about starting a show around creatine. I need to be taking it like my brother here, Tom. I got to start doing it. Thank you, Tom. Thank you. Yeah. I need to start. I'm still not taking. I'm going to start taking it very soon. Don't tell Doc. But I mean, I left that episode with Robin thinking like, who shouldn't be taking creatine? So anyways, that was a great episode with Robin Riddle. I hope you guys will check that out. Creatine over there on YouTube as a part of our Explain This episode. So check that out if you haven't. Let's see. Foxy Moxie, what's this? What commercial did you see? I'm very interested, actually. Well, I really want to know because we've gotten a couple of comments around this. So let me know, Foxy Moxie, what commercial you saw. I cannot wait to show Doc. Yes, Tom, I got to. How many milligrams are you taking? I'm thinking I'm going to start with 5. As Robin says, everybody watch that episode with Robin Riddle. She says start low, work your way up. Samantha, what's going on? It's so good to see you. Thank you for hanging out tonight. All right, we're taking questions here too. We're taking questions over here on Instagram. We're taking questions here on all the YouTube, the Facebooks, everywhere. One scoop with coffee. Okay. Well, in your coffee. Interesting. Okay. I need to look into what are actually Robin goes over best practices in terms of how to take it. So watch the video, watch the episode. All right, we're taking questions here. I see Frida's got a red light therapy question. I see Jay's got a question around varicose veins. Thank you, Jay. It's a great topic. Yeah, we're ready to go. There he is. There's the doc. I've got a Foxy Moxie who's in New York saw a commercial with you in it today.
I wish I was in New York. Really? Really?
I need to see what it is. You got to tell me, Foxy Moxie. My brother Steve's in the building. What's going on? Samantha, what is going on? We got huge news with Samantha. We can't wait to announce it. Welcome. Abingdon, here we come. We're not going to announce it officially yet, but we're you guys, y'all are family here. We're coming to Abingdon very soon.
Place I wanted to be for how many years?
So long, so many years. Ever since I started working with you.
Yeah, ever since you were a tiny baby, you wanted to go.
Since I was a child.
I've been riding the creeper since you were a baby. I really have.
You've been riding the creeper since I was a baby?
Yeah.
It's kind of cool.
Before you were born.
Guys, as you see, we picked up the mics. We record this for a podcast. The podcast version comes out a week later. So if you miss it, if you miss the live show, 1, don't miss the live show. 2, you can catch the replay over there on Apple and Spotify. How's your day, man?
It's been great.
Yeah. You busy in the office?
Very busy.
You had a kind of for the crew here that's live, I like to give a little behind the scenes around Common Sense MD episodes. And you came up to me, I think it was Sunday, and you knew exactly what you wanted to do for Common Sense.
Yeah.
And it was around the video with Dr. Makery. Can you kind of, for the people who haven't seen the video yet, kind of talk a little bit about what Dr. Makery said?
Well, Dr. Marty Makery is the new commissioner of the FDA. Thank goodness. And he is a well-known Johns Hopkins surgeon, but he's also a public health researcher. He does a lot with innovative ideas and kind of challenging the status quo. He's so big that he's kind of hard. You can't challenge him.
Okay.
He was one of the guys that they couldn't mess with when he started talking about how they were doing COVID wrong. So, I mean, he's kind of like one of those untouchables. He's too big, too well known, too smart. But in any event, so I just happened to catch a glimpse of him, a clip of him
Yep.
on one of the morning shows.
Yeah.
And he was talking about women's hormones.
Yeah.
You know, something we've been doing for 18 years since I started my private practice, and how beneficial they are to you. So it really just, and how terribly flawed the Women's Health Initiative study was back in 2003, and how it misled a whole generation of women going through menopause and doctors who weren't taught about hormones.
Mhm.
Or if they were taught, they were taught to fear them. And when you look back at the studies, and since then we've had many more studies, and the studies are positive. I mean, like I'm always preaching, and he said this on national TV, so I think it'll kick up a lot of use of bioidentical hormones with the women who have been missing out on it. And he was really talking about how heart protective that hormones are for women, and how it does not cause breast cancer, how it's very, very effective at preventing heart disease, way more effective than a statin, which, as you know, are not that effective for preventing heart disease. I had 2 people today that I took off statins. They didn't need them. They were causing side effects. They were misled. And another patient who told me he just would not take them. His doctor really was all over him for it. And I looked at his panel, and first of all, he didn't have a Cleveland. He just had a total HDL, LDL, not an ApoB, not an LP little a, not a particle number, not a Berkeley heart panel. It's total incompetence, really. And it's not the doctor's fault. That's the way they're taught. Plus, they're compensated by using more statins. They get bonuses based on how many statins they use. I know, because I used to be part of the system. It's so wrong.
It's so fascinating.
So anyway, but but Dr. Marty Makery, who wrote the book Blind Spots, which is just a great book on, how the medical establishment is really caught up with this thing we call cognitive dissonance. And that meaning, if that's the way you learned it 30 years ago or 40 years ago when you're in medical school, that's the way you're going to practice it. And you're not willing to learn anything new or entertain new ideas. It uses a lot of examples about like peanut allergies, appendectomies. I mean, it's just a wonderful book. But anyway, so I'm glad we have him up there, and I'm glad that he got on national news and legitimized the use of bioidentical hormones. I mean, most doctors don't even know the difference between medroxyprogesterone and micronized progesterone. Totally different. And I've actually gotten in an argument with a couple of GYNs. They do not know the difference, and it's a huge difference. Yeah. But in any event, estrogen's protective for you, ladies. But I understand Andy was here last week. And we had a good. I'm going to try to get him on here once a month. We're
going to get him back. He was a fan favorite among everybody, as always. And I'm also seeing another fan favorite in here. Robin Riddle's in the building. Everybody say hello to Robin. Everybody say hello to Robin, and say thank you for the video today on creatine, because it was fantastic and her audio was fantastic.
Hey, speaking of creatine, I heard you and Annie talk about booty rate last week. Why we add booty rate to our creatine?
Come on, guys.
What is booty rate?
I had this came up. It's been a dinner conversation in my household all week from the way I pronounced butyrate. I apologize, everybody, for my mispronunciation.
You said booty rate.
I said booty rate, and I still can't believe I did. But anyways, yes, your creatine has hydroxymethyl butyrate in it.
Yes, HMB, which is another muscle builder.
Yeah.
And fat burner. I think it's just a great addition to creatine. You might as well take HMB in there if you're taking the creatine powder. So
Yeah.
it just makes it work better. So, but anyway, so yeah, I hope they learned something about booty rape last week.
Booty rape.
Did Andy make fun of you for that?
Esty Bessie's in here. Booty what? Jasmine Altman's in the building. Jasmine, how are we? So good to see you. Congratulations. I'm super excited for you. Guys, we're taking questions. If you have a question for Doc, go ahead and put it in the comments. We're getting a lot of hello Robin's in the building. Shout out to Robin Riddle. Thank you, Ivy. Thank you, team. All right, everybody. We got a few people watching the creatine video. Thank you, guys. All right, we're going to answer some questions.
Speaking of Robin and Ashton are going to Scottsdale.
Rock on.
I heard that today.
That's amazing. A4M?
I think it's an A4M. Yeah, it's
awesome.
It's a hormone conference, I think. So that'll be fun.
Well, look at this comment from Robin here. I have a patient with an undetectable LDL from high dose statins. We were talking about statins. Total cholesterol less than 80. Crazy. So, of course, his hormones are all out of whack.
Of course.
Yep.
Of course. That's very dangerous. It's really more dangerous to see a cholesterol under 140 than 300, I think. It's a precursor to all your other hormones. So it's just nuts.
Real quick, guys, we are taking questions. So if you have a question for Doc, go ahead and put it in the comments. We're going to get to everyone tonight. How big of a, kind of leap was it for somebody of Dr. Makery's stature to come out and take this stance with hormones? Because I know it's got to be a little bit against the grain,
The evidence now is so overwhelming. It's not even really controversial to anybody that looks at it. So it's going to become a way bigger thing in my prediction. It's kind of been one of those niche things that we've done for many years. But I think that, if a woman's approaching menopause and, within 10 years of menopause, you need these hormones. There's a few people that shouldn't take them, very few. But if you do hormones, you need to do it with somebody who knows what they're doing.
Yeah.
Without a doubt. And there's a lot of people that don't know what they're doing with it. So,
and that's also with anything though in healthcare. You want to go to somebody who knows what they're doing within.
Of course, especially with hormones. But the problem is they're not teaching it.
Yeah.
And there's no drug reps going to talk about it because there's no money in it for big pharma. But so I'm hoping that it'll, educate a lot of women about why they should think about getting on bioidentical hormones.
Well, one thing that you mentioned and Dr. Makery mentioned was, if you can get started on hormone therapy within 10 years of menopause, it's a huge advantage. I've gotten some comments today on our social media that, what if I miss that window? Am I too late? What would you say to that woman?
No, not too late.
Okay, it's never too late.
And again, it's not just for hot flashes or night sweats. It's for your brain, your bones, your muscle, your energy, your well-being. So, earlier the better, but do it. And he didn't even mention the benefits of testosterone. They didn't even mention that.
It was all about progesterone and
estrogen and progestin. Yeah. It wasn't even mentioned testosterone, which is the one hormone that has all the good effects. All of them, male or female. Of course, females need testosterone as well. That's the one you're going to feel the best on.
So even females.
Most people say, "What? You putting a female on testosterone? Come on." They have no idea. Women need testosterone.
And it's in the dose as well, isn't it?
Just of course, low dose.
Yeah.
So.
All right, guys, we're getting to questions. I encourage everybody to watch that Common Sense MD episode. Like I said, the part with Dr. Makery, it's on the Morning Joe, I believe, on MSNBC's YouTube channel. It is in the latter part of the Common Sense MD episode today. So check that out. All right, we're going to get to questions. Jasmine, I see your question. We're going to get to that in just a second. Let's start with this one right here. What interventions would you suggest to flip pattern B cholesterol to pattern A? And I have some, I believe that, I don't think I have any context for this question in particular, but I do have a follow-up question to the same listener.
Oh, okay. Well, that's something that, just like we were talking about, when you look at lipid panels, you really need to know a lot more than just your total cholesterol, HDL, LDL. You need to know particle size. You need to know if your LDL is oxidized. Typically, we think of HDL as being good cholesterol, LDL as being bad cholesterol, but there's a lot deeper look at it. Maybe the most important thing is the ApoB measurement, which summarizes all the atherogenic particles in your LDL, the bad cholesterol. So a lot of it has to do with particle size, but so we do check an LDL type A or type B. Type A is the one you want because it really means that your liver is able to clear the LDL out better. Remember, HDL is like the garbage cans that bring the bad LDL to the liver to detoxify and get rid of, to prevent plaquing and oxidation and things like that form plaque. But so we do check that, and I have seen some people that could actually flip it over from a pattern B to pattern A. It's not as easy as you might think, but a few things, of course, diet and exercise always come into play there. And again, you don't need a low cholesterol diet. If you go on a low cholesterol diet, your liver just starts cranking out more cholesterol because you need cholesterol. But it is better to have a type A LDL pattern than B. And some of the ways that you can do it, and I think some of it may be hereditary, because I've seen people that are tremendously fit that had a normal total cholesterol, normal LDL, good HDL, who had a type B pattern. I think that may be somewhat genetic, but certainly with diet and lifestyle, if you're obese, it's bad. A lot of it has to do with insulin resistance, really. And one thing that, of course, I don't like to use statins. A statin's not going to do that, in my opinion. But one thing, I've used niacin to kind of, in a few cases, to flip that over. Vitamin B3. Of course, if you do use niacin, start out really low because it's going to flush you. The non-flush, called niacinamide, which is great for preventing basal cell skin cancers and good for a lot of other things, will not do that. It won't have any effect on your cholesterol. But niacin, just plain niacin, will have a positive effect on your cholesterol. It's a good kind of natural way to do it, a supplement. But if you do it, start out really low at 100 milligrams. Because if you start on the over the counter, you start on the 500 milligrams, you're going to get over the counter, you're going to flush and go to the ER because you think you're having an allergic reaction to it.
Yep,
so start at 100 milligram at night, take it with your aspirin, and you'll sleep through the flushes. And then every 4 nights, advance it by another 100 milligrams till you get up to 500. And you could take it on up to 1,000 or higher. So you just slowly build your way up. So niacin may flip you over there. We'll see what else. Did you have another comment, or he or she?
Yeah, let me see here. Okay, this is same listener here, potentially a different question. I'm 63 male with visceral fat score of 2. I'm assuming that's on like an InBody or something.
That's a great
similar.
That's a low fat score.
And a body fat percentage of 8.8, which is incredible. I follow a low carb diet and exercise 4 to 6 times a week, and take berberine, fish oil, fatty 15, and red yeast rice. Question.
I like fatty 15. I take fatty 15.
I've heard you talk about fatty 15.
I need to do a podcast on that.
You want to do a podcast on fatty 15?
Yeah, but not tonight.
Not after the show?
No. Let me go ride my bike.
Without having a gallbladder, the liver does all the work. So in this case, is it a good idea to eat the carnivore way, or is this too much fat for the liver?
If you don't have a gallbladder, you need some digestive enzymes. I don't think it's, as long as it's not trans fat. Again, I don't think saturated fat's the demon that most people think it is. But certainly, no, I like the carnivore diet. A lot of it depends on your gut health. Again, if you don't have a gallbladder, you need to be taking something like DigestShield that has digestive enzymes in it, along with your pre and probiotics. I'm always preaching about DigestShield.
Oh, yeah.
I love it so much.
Yeah.
But always keep an eye on your liver function test. Alcohol is, of course, a lot worse than fat for your liver. So I'm good as long as you man, I mean, you've got a great body fat percentage and visceral fat. Those numbers are incredible, especially for 63 years old. Excuse me, man.
Bless you.
I'm allergic to something in the air right now. Last 2 days,
I've
I've been sneezing my head off.
I have too.
Really?
I noticed it starting this weekend. Yeah. I don't know what it is.
I don't know what it is, but I never get allergies in the summer. I don't know. It's not any kind of sickness, but anyway. But say, yeah, carnivores. I like carnivore. Go to Salandino's. You know, he's starting to eat a lot of fruit with his, but I don't think so. You know, keep an eye on your liver function test. Interesting case, but man, congratulations. I wish I had numbers like that.
Yes, great numbers there. Thank you for the question. It came in through email today. We always appreciate those, getting the show started. We're going to live questions now. And real quick, I want to start with my SD bestie, Jasmine Allman over here on Instagram. JR is wanting to know if people with kidney issues should take creatine. Wants to know if people with kidney issues should take creatine. And that is a common misperception.
Yeah. You have to be maybe somewhat cautious, but creatine is not going to hurt your kidneys. Now, if you have really marginal stage 3 or 4 kidney failure, I'd be careful about taking any supplement. Certainly if you do, then, you know, get your renal test done, and certainly check a cystatin C along with your regular, GFR. So that's a common thing that people think they have renal problems, especially muscular men. They're going to have usually an increased creatinine.
Yep.
So if that's the case, then draw a cystatin C with your CMP, and you'll get a true function of your GFR, glomerular filtration rate, which means what your true kidney function is. And make sure you're hydrated. But it's not the demon that people think it is. And it does help build muscle. Some people say, well, it just makes you retain water. Well, it does help you retain water in your muscles. So I think of it as hydrating your muscles. Your muscles work. Anything works better hydrated.
Yeah.
Joints, muscles, skin, connective tissue, brain, everything. So if it's severe, check with your nephrologist first. I would always tell somebody that. Because if your kidneys are really not filtering, that you got to be careful with taking any supplement.
Yeah. And just you want to make sure you take the right tests.
Yeah.
Okay.
Yeah, but I'm sure if you're seeing a nephrologist, I'm sure you're probably doing the right testing.
I'm with you.
Hopefully.
SD Bestie, I hope that helps. Thank you for the question. We are taking questions over here on Instagram, so if you have a question, go ahead and put it in the comments. All right, we're going to keep moving here. Let's see where I'm at. Let's go to Jay over on YouTube. The question is, I bought a Lumara red light pad. It goes up to 5 settings. What setting, how long, and how many days a week do I need to use it to help with shoulder tendinopathy?
I love the Lumara red light pad. That's one of the ones I have. But yeah, I go all the way up to 5. Why play around with it? Go to the high setting. Set it goes to 20 minutes. Do 20 minutes twice a day. I put it on my back, my neck, my knee. 20 minutes twice a day, morning, night. Turn it all the way up.
And with Jay's also asking for his wife to help treat varicose veins with the red light pad. I'm assuming, Jay, any different protocol for this?
Yeah, I do the same thing. 20 minutes twice a day, full dose.
All right, Jay, thank you for the question. Another red light therapy question from Frida. Is there any kind of light therapy, red light, etc., that can help with sundown syndrome for the elderly, especially my mom, which is 92, seems to do better eating and being awake more than later sun setting? And I hope I'm interpreting that right, Frida. What's your thoughts on this?
I mean, one of the things I would do is use red light at night, and I would use white light in the morning, like a 10,000 lux bright light that's about the size of this computer that people use for depression. in the winter.
Interesting.
So I would do the red light at night. That's a song, isn't it?
Is it winter depression?
No, red light at night.
Could be.
Anybody heard of that song? I heard it the other night.
Really?
Yeah.
I was thinking about
Or maybe Red Sky at night. Red Sky at
maybe
night.
Red Sky.
It's a famous song.
That still kind of goes
it's
with
an
this.
old timey.
It still kind of works.
Yeah. So use a red light at night and bright white light in the morning.
Huh.
And avoid blue light, especially at night. That really disturbs sleep. And the sundown is a real thing. It's a real thing with elderly people. I had a lady, elderly lady, in the hospital one time years ago, back when I did hospital work. And I forgot what she was in there for, but people don't get, normal mental acuity people go in the hospital, they're sick, they do sundowning. They get crazy at night. Any nighttime nurse will tell you that. But I had one lady who was in there totally normal other than when she's in the hospital. But one night I saw this. She was complaining about not being able to sleep. And the nurse was just joking around with her. Says, I'll just take hammer and conk you out. You'll be fine. And she took it literally.
Whoa.
So she went AMA that night in her nightgown and was caught walking down the turnpike in the middle of a 4-lane road.
Wow.
Because she took her literally. So sundowning is a real thing.
Yeah.
You gotta be careful of that.
Super interesting. Frida, does that help any? Thank you for asking this question for your mom. I hope she continues to do better. So thank you, Frida, for that. Real quick, I see this from Shelby Jean, the Dr. Rogers brand. The Dr. Rogers creatine has HMB in it as well.
What's that stand for? Booty?
With hydroxybutyrate?
Yeah, I like the 5 grams powder with HMB in it. Ours has both of them in there.
And Shelby, you can find that performancemedicine.net. Thank you for the question. Let's go to Roel. Doctor, I take losartan 25 for blood pressure, but lately my blood pressure has been high. Should I consider a bigger dose? It's been very hot. As you know, Roel's in Texas, and the heat is bothering me. I listened to your podcast on blood pressure. Continue.
Yeah, wow, it's been hot here too. It's really, really hot and humid. Dangerous, really dangerously hot. Last week I played pickleball from 12 to 2 on one of those 90-degree days, humid, and I was exhausted for 2 days. And I thought I was hydrating. I was using Elemental and hydrating, but it's you got to hydrate like a week ahead of when you have something like that. You can't hydrate the night before that day. You got to really build the hydration up. But yeah, that's such a low dose. Go to 50. The normal dose is going to be 100. So go to 50. Losartan 25 is just spitting in the winds. And 50 is not going to hurt you. It's one of those, just doesn't have many side effects.
Yeah.
And it would be in that class, an ARB that I would take first.
Okay.
So yeah, pop it up to 50 and see how you do, and don't get overheated.
Add this from Will. I also take 5 milligrams of tadalafil. Stop my TRT at the moment. Should I consider supplements or more BP medicine? It kind of goes along with the losartan question.
Take the 50 of losartan without question. Continue to take the 5 milligrams of tadalafil. So many positive benefits to that besides ED. I mean, it's a wonderful, wonderful drug for many, many things. I use it in a lot of women too, especially for something like Raynaud's. But yeah, I would just do that. If you take tadalafil, you don't really need to take a lot of other nitric oxide agonists, really.
Thank you, Roel, for the question there. Let's get to Lisa. Lisa, we've been thinking about you, so thank you for being here tonight. I had my MRI, and it said tear at the origin of the left hamstring tendon with associated M-reactive tensile edema. I hope I'm reading that correctly. Within the left ischial and subcortical edema, within the left ischial tuberosity, deep to the left hamstring tendon origin. Hope I read that right, Lisa.
That sounds like a a radiologist interpretation of this thing.
Yeah, that's
using a bunch of big words.
Likely reactive tensile edema. Ortho says a lot of bleeding and swelling in there. Hurts to walk, do stairs, and sit. Any helpful hints are so appreciated, plus prayers. Well, of course, we got you with the prayers, Lisa. We're going to be thinking about you, and thank you for asking the question tonight. Any helpful tips
Prayers
here?
are always great.
Yeah.
But there's another thing called tincture of time, and that means it will get better. You just have to let it get better. That's going to be something that's going to have to take time to settle out. I do like BPC 157, which is a peptide that you can take orally. I think it helps things heal a little bit better. I take it anyway, daily. You're just gonna have to give it time. Yeah, at least it's a tough one. You know, it's not something that they're probably going to go in there and want to repair anything. You know, that's a toughie. Sometimes some orthos are going there and with injections like PRP, but I think it'll get better with time, and then some physical therapy would help you. So if it hurts to do it, back off a little bit. I hope you're able to walk and move and do some passive range of motions. Work with the therapist. Get in a warm tub of water, particularly maybe with magnesium in it. I like magnesium chloride over Epsom salts.
I know we got a great question around that, and for an athlete in town, and you mentioned
that's
that.
Right, we did.
Yeah.
Soaking in there with general range of motion while you're in there with the magnesium would help. You know, maybe get some BPC 157 and give it time. You'll get better. That's just a hard injury to heal overnight.
Lisa, we got you with the prayers. I love that term, tincture of time, because you know a lot of things that is kind of the answer is tincture of time. Thank you for
Seems
that.
like the older you get, the more time it takes to is what I'm experiencing.
Yeah.
I don't recover like I did.
Yeah. Same.
Just don't do it.
Yeah. All right, let's keep moving here. Thank you guys for all these amazing questions and comments. We appreciate you. I'm looking at Instagram as well. We're taking questions. Julie, what's going on? Hello. I took a read today of your email, and it was interesting as I had the same negative thoughts of HRT, I'm assuming. This is a comment.
I love that she calls high boys. That makes me feel really young.
Yeah, we're like brothers.
Yeah, we are. Thank you, Julie.
Julie, that just made our night. Thank you so much.
That is wonderful.
And thank you for reading the weekly and the doctor's notes and all the content. We super appreciate that. All right, let's keep going. Oh, Robin, the conference is on women's health. That's fantastic. That's awesome.
Wonderful.
That's awesome. We'll have to do a kind of an episode around all the things that you and Ashton are learning out there when you go to the conference. That's super cool.
Great.
All right, let's keep going. Thank you, Julie, for the kind comment. Let's get to D-Lynn. D-Lynn, thank you for being with us tonight. And then I'm going to get to Barbara. I see you, Barbara. Can the heat and humidity cause swelling in the feet and ankles? Some days mine swell, and it's mostly with my clients that don't use the AC. They go down before I go to bed. What's your thing? I've noticed. Yeah.
Definitely. There's no doubt. You will swell in this kind of weather. You really will. You really have to kind of take it easy. A lot of people know how to work out hard and exercise, but they don't know how to recover.
Yeah.
And that's certainly in this kind of heat, just try to avoid it if you can. And when you sleep cold. I have a Sleep 8 bed mattress cover that's amazing. It chills my body down at night. It's an awesome little thing. It's called a Sleep 8 bed. And actually one of my patients turned me on to it.
Yeah.
And just wonderful. It uses AI to kind of interpret what your body needs. Also gives you a wonderful readout of how you slept. I think it's even more accurate than my Oura Ring for my parameters at night.
Yeah.
I know it is. So look up a Sleep 8 bed. Cool your body off at night. And, you know, you may be one that would like a cold plunge.
Yeah. Would a cold plunge actually like do a good job of offsetting? Because a lot of us can't avoid, you know, the heat during these months.
It would.
Okay.
I like a cold plunge.
Thank you, D-Lynn.
Or even a cold shower.
Let's see here. Carter, I see you. Happy Tuesday to you. I see I missed a question. Where am I? Oh, Barbara, here we go. Doc, how long before my pellets kick in? This is a great question. It's been 2 weeks for Barbara. And by kicking in, I'm assuming like feeling better. What's your thoughts on this for Barbara?
Well, I want to apologize to Barbara because we made a mistake. We put in sugar pellets instead of the regular hormone pellets in her last time. I forgot to tell you that, Barbara. She's probably not laughing. I'm kidding. No, usually it's about a week.
Okay.
It's interesting. I hope you're not getting out in this heat because I think that could affect the way you feel. I mean, people, I call it the dog days of summer. People feel bad now.
Yeah.
I mean, I'm not kidding you. You need to really
Tired.
take it easy.
Okay.
Especially people like me and Barbara who are over 60 years old.
Yeah.
I didn't mean to give your age away, Barbara, but you're getting close to 60, I believe. So, yeah. It'll kick in.
So if it's been 2 weeks, you're saying just to
we didn't shortchange on the pellets. I promise.
Just kind of take it easy over the next.
It will kick in.
Barbara, keep us posted, okay? Let us know next week if you're feeling anything start to kick in for us, okay? All right, let's keep moving here. Let's go. Let's see. We got a couple Abingdon questions. Thank you guys for that. Let's get to Angie real quick. I'm 58 and was diagnosed with diabetes at the age of 9. In my early 20s, I had a retinal detachment and lost my vision in my right eye. I had a total hysterectomy last summer, and the hormone replacement therapy carries risk of blood clots in the eye. Do you have any suggestions for Angie? Angie, thank you so much for the question here, and hopefully we can help.
That's when my daughter came down with type 1 at age 9, and then my son came down, Andy, at age 13. I'm sorry about your eye. Gosh, that's just a blow. And then you had a total hysterectomy. I don't know who told you that hormone replacement therapy carries a risk of blood clots, but in my opinion, it doesn't. Remember, you're using bioidentical hormones, you're using it through patches or creams, not oral. If you do it orally, oral estrogens or medroxyprogesterone, they are bad. They're not terrible, but they certainly have to pass through your liver, could affect your clotting factors. But remember, when you do creams, which is what we mostly use, or pellets, we don't use oral estrogens, and we do not use medroxyprogesterone. We use micronized. So, make sure you're talking about a bioidentical hormone cream causing a blood clot to the eye. I have a hard time believing it. Again, check with your ophthalmologist and say, show me some studies. Are you sure you're talking about bioidentical hormone cream that does not affect clotting factors? I even put people on hormone cream that are on Coumadin. It doesn't bother that. So do a deeper dive. If there's some other reason they don't want you on it, if they just won't do it, then you may have to do some other things, like maybe some evening primrose oil and some other herbal like things, but it's not going to have the effect that bioidentical hormones have. So do a deeper dive with somebody that really knows the hormones, because that's the problem with a lot of specialists is, they have a one-track mind, and they don't know much about hormones or anything about hormones. Like a cardiologist who thinks testosterone causes blood clots. It doesn't do it. It's been removed from that black label warning. And that's what Dr. Marty Makery is working to remove any warning on estrogen, bioidentical estrogen products that might cause heart disease, because it doesn't. It protects your heart. So do a deeper dive, and you always, with anything, you have to weigh the benefits versus the risk. But as far as I know, I don't know why it would cause that increased risk.
I got to put this up here because this is so cool. By the way, my mom is Barbara. That's awesome.
Oh,
that's amazing.
Oh,
Angie, we love you already.
You got a great mom.
We love you already. We love Barbara. Thank you so much.
Sense of humor. That's why I always kid around with her when she comes up here.
Angie, this made my night. Thank you for that. Thank you for that comment. Thank you for the questions. Okay, Corey got your joke.
He did?
Corey says sugar pellets. Okay, let's keep moving here. I know I'm missing some, so I'm going to do the best I can to find. You guys have some amazing questions. I'll put this up from Bentha for everybody. Looking forward to the Abingdon office. We are too. Any ideas when it will open?
Around the 1st of October.
We're thinking first week of October. So stay tuned. We will have a bunch of announcements around it. We'll start to put that out here. We'll be talking about it first here, of course, on the show. Thank you, Bentha. And then, of course, my brother Mark is in here. Will an Abingdon PM office prescribe medical marijuana? THC can modulate the immune system, potentially acting as an immune modulator, immune selectivity, cytokine production, and immune responses.
Yeah, I'm sure, in Virginia, it is legal for medical marijuana. That's one reason I have an office in Bristol, Virginia. Tennessee, it's not legal. But there's some good uses for not only CBD, but also THC in certain cases. But you're right. I had somebody today tell me that that's the only thing that helped their pain. And of course, they don't want to be on opiates. So stay tuned for that one. Thank you for mentioning that, Mark. You're certainly on the top of everything.
Mark, thank you, brother. Thank you for being here as always. Real quick, Pop, will you give a shout out to Kyle? He's on a 24-hour fast right now, and he's going for 72. So, wow. Kyle, we're proud of you. Keep going. Shout out to the family. Happy birthday to Katie, whose birthday was yesterday. Hope you guys had a great family. Day. The best family.
I wish he'd come up here and visit.
Yeah,
He's a pretty busy guy.
Come on. All right, let's keep moving.
Kyle. You'll do fine.
Kyle, you got this. Kyle's
your brain will clear. You start thinking better.
Well, that's the one thing he said, because he's done these longer fasts quite a bit. He said it's the mental stuff that he notices more than anything. It's just everything. It just becomes way more clear.
Yeah, so, there's no doubt about it. Your brain works better on ketones than it does glucose. So.
Yeah. Kyle, I love you, brother. Thank you for being here. All right, let's go to Cody. Thank you, Cody. Can gallbladder issues present and or mislead into thinking of food sensitivities?
It could. Gallbladders are kind of the great masquerader. And having a dad and a brother that were general surgeons that did a ton of gallbladders. A lot of times, a lot of things clear up when you have gallbladder problems. So you always have to think about that. And even though your ultrasound may be normal and not have stones, a HIDA scan can show more true gallbladder function. So it certainly can. We do some food sensitivity testing that's also very interesting. Seems like sometimes the foods you crave the most are the ones you're most sensitive to. I found out, certainly myself, I've had mine checked, and it's true. So I always tell people, before you get a food sensitivity test, like a Dunwoody or an AllCat, make sure you're willing to make some changes and give up some stuff you love.
It can be disheartening to see.
Yeah. You can't drink coffee.
Yeah.
You can't eat shrimp. Something like that. Again, it's food sensitivity, not food allergies, food sensitivities. But yeah, it can.
Well, thank you for that question, Cody. All right, let's keep moving here. I got a couple from Danny. Thank you, Danny. Is grass-fed whey protein, let's see, is grass-fed whey protein, we have colostrum, a good way to boost your protein intake? Let me see if I can, is whey protein with colostrum a good way to boost your protein intake?
Yes. Yeah, it's a very good way. Colostrum's wonderful. My daughter, Kelly, swears by it.
Bovine.
Yeah.
She sent the text today.
Yeah. And she has a particular brand that's fairly expensive, but she swears by it.
Yeah.
From everything and every way she feels better.
Yeah.
She's a type 1. But colostrum's an amazing product.
Danny, I hope that helps. Thank you for that question. Let's go to Rachel here. Thank you, Rachel. What is your thoughts on vibration plates? Do you think they are helpful, and are there any contraindications to using one? I've been on a vibration plate before.
Oh, me too. They're great.
Yeah.
They're fantastic. They'll double your workout.
Yeah.
Did you take a picture of me?
I think I did.
Over at the Nottinghams. I was on a vibration plate inside a red light front and back.
I didn't know you were on a vibration pad. I knew you were like with.
And also, there had bands you could exercise.
No kidding.
All in one.
No kidding. That's awesome.
Total body. So yeah, I mean, there's no doubt that it's kind of like working out on a bocce ball or something where you have to balance. So it's kind of that same theory that if you're having to balance, you're recruiting other muscles and tendons that make you functionally way stronger. So I love a vibration plate. It also helps lymphatic drainage. The first thing I do when I wake up is jump on my mini trampoline.
Yeah.
But I wish I had a vibration plate.
Yeah.
I just can't afford one
That's interesting.
right now.
That is interesting. I actually never heard you say you want a vibration plate.
Well, I'd love to afford one, but I'd have to start working 4 days a week instead of 3.
Rachel, thank you for that question.
I love them.
Let's see. Helen, who is in San Diego with no pollen. She's got clear sinuses.
San Diego, you probably have a beautiful life. I mean, that's probably the best place in the country you could live.
I love San Diego.
Unless you couldn't afford the rent.
It's true.
I love San Diego. My niece and nephew just moved back.
Yeah, they loved it.
They absolutely loved it. What was the name of that beach that they lived on? It's right up. Gosh,
I forget what it's
Josie
called.
worked in Coronado with the
Coronado,
Navy,
yeah.
and he worked at Pendleton. They're right in between Soldana Beach, but anyway, we're getting off the point. But it's a beautiful place. I hope you're a surfer.
Helen, thank you. Let's answer this question for Ellen here. Your thoughts on red yeast rice plus CoQ10 in place of statins?
Yeah, I'd rather do that than take a statin. But remember, red yeast rice is kind of what they call a natural statin. So you could still deplete your CoQ10. So yes, take CoQ10, if you have any adverse effects. The only problem with red yeast rice is the quality control. Sometimes you might not get the right dose, but you can certainly follow your lipids. That's another thing you could do to maybe influence your type A, from type B, LDL patterns. So I'm not against it. Certainly, if you have any muscle aches or don't feel good on it, then you could do something different, like a low dose niacin. But I mean, I think CoQ10 is something that most people enjoy anyway, even when they're not on a statin. I certainly take CoQ10 with PQQ. So that's my thoughts on that. It's better than the statin, prescription statin, because it's way weaker.
Thank you for that, Helen. Let's get to Tiffany here. Tiffany, thank you so much for being here. How to get rid of cellulite in my thighs, 42-year-old African-American female. I know so many have asked very similar questions to this as Tiffany. What would you suggest for cellulite?
I know there's some creams and there are some laser treatments that get rid of those little band-like pockets of little fat globules. But I would say melting them with a machine like Kelly has.
Metal therapy.
She's got 2 different machines. One of them uses a laser, another uses ultrasound. Basically, they heat up those little bands and kind of destroy them. She's had pretty good luck with that.
Really?
Yeah, and some people will inject different enzymes into them to try to get rid of them. I used to do some of that. I never had great luck with it. Some people claim that certain, and Kelly or Jasmine could answer this way better than we could, but of lotions and cream that may help appearances of them. So we'll try to get a better answer. I'm going to try to either do a little podcast or a little something with Jasmine or Kelly about how to maybe deal with this.
Yeah. Tiffany, thank you so much for this. And what we'll do is we need to double down on a question just like this around cellulite, especially during the summer. So Tiffany, thank you so much for that. I hope that helps just a tad. Okay, let's keep moving here. We're going to get to as many as possible. I saw one. There we go, Connie. Thank you, Connie. I use the HRT cream and put behind my knees each morning after showering. Should I use on my thighs? What's your thoughts on this?
Not really. Either place works. the thinking is that behind the knees or on your wrists is a little bit more thinner skin, more vascular, may get in quicker. But in my opinion, you should put it over, more of an area that has a little bit of fat on it, so slower absorption. But really, the main thing is move it around and use it in different locations. Is the way to do it, because most likely it's got a little bit of testosterone in there. If you put it on the same place month after month after month, you could get a little hair growth in that patchy hair. But
Would you
move
say
it around?
Move it around like once a month, or
no, every night,
every
okay, different spot.
Okay, Connie, I hope that helps. Thank you so much for that question. Don here, thank you, Don. Do you know if methylene blue could help Parkinson's?
It can certainly help in the manner that it can give you better focus, more energy. Tremor, I haven't seen it improve tremors too much, but I've certainly used it in a lot of Parkinson's patients for focus. But yeah, it's certainly one of those worth trying.
Yeah.
Even medicines like LDN, low dose naltrexone, nicotine patches is one of my favorites to use for that. Outside the boxes, besides carbidopa, levodopa.
Yeah.
But gosh, we're seeing a lot of Parkinson's disease.
Yeah.
It's just on a rampage. Who knows if COVID started, if the vaccines kick it off? I don't know, but we're seeing a lot more Parkinson's than we ever saw, ever.
Don, thank you for asking this question. And we've put out a couple of videos more specific around. It's not
going to hurt.
Specifically with methylene blue and LDN for to help with Parkinson's. So I hope that helps a little bit. Rachel, I see you. Tabitha, I see you. Thank you guys for being in here. Let's get to Corey. HRT via liquid under tongue. If I miss a night, how long does it stay in the system?
It's gone within 24 hours.
Okay.
For the most part. It's in pretty quick.
All right. Hope that helps. Corey, thank you for that question.
24 to 36.
24 to 36.
36 for sure. Yeah.
All right, guys. I'm trying my best to get to everybody. I know I'm missing a few. If I've missed you, give me a little nudge here. SD Bestie is saying collagen consumption helps with cellulite. So, yeah. Tiffany,
great point.
I hope you're still here.
Thank you.
Jasmine is saying collagen consumption helps with cellulite. Thank you so much, Jasmine. Thank you for that.
I put a little
wonderful
keto
comment.
collagen in my coffee every morning.
Do you really?
Every day. I love it.
When do you take your creatine? I know it's nothing to do.
I usually take it in the afternoon for some reason. The best time to take creatine is anytime. Before, after work, I don't care. Just take it.
Okay, let's go. Roel, did I miss a question of yours, Roel? Let's get to TT Warrior 1. Here's a different question. I gag bag when I brush my teeth and occasionally will throw up. My wife says it's because I'm not breathing while I do it. And I think they're saying, but I disagree. So I hope I'm reading that right, TT Warrior. Do you need more context in that?
No, I think, I hate to get in between husband and wife arguments.
That's true. That's true.
You got to be very tactful about
That's true. That's
but
true.
some people have a real strong gag reflex. I mean, you put a tongue blade in there, look at their throat, tonsils, and they gag. So it's just, some people just do that. But it is true that if you hold your breath, you may be more prone to it. So always try to be a nose breather anyway.
Yeah.
So a lot better to breathe through your nose. But one thing, now it's not, is it that your wife's throwing up when she watches you brush your teeth? Is that the thing? Or I don't know why I said that. But anyway, some people do have an exaggerated gag reflex. It's just crazy. They can't even, take a sucker. And but which brings up another good point. You should use a tongue scraper. That's a very healthy thing to do.
Really?
Yeah. Or
does it help
brush
with
your
that?
tongue. It doesn't help with that, but it just helps clear out some of the bad bacteria. But never, here's one thing I'll tell you never to do is use a tongue scraper and then take Listerine or Scope a lot of those bad stuff in it. Don't do it. That kind of stuff's terrible anyway. So if you do happen to use mouthwash, do not use it after you scrape your tongue because it goes right in your bloodstream. It's very toxic anyway, so don't use those typical things.
That's interesting.
I don't mind you gargling with hydrogen peroxide, but yeah, try it. I mean, try breathing through your nose when you're brushing your teeth and see what happens.
Thank you, TT Warrior, for
you start thinking
being
about
with
it.
us.
You'll
Yeah.
gag.
Yeah. Thank you for being with us as always, TT Warrior. Let's get to Kathy here at almost 68. Is it too late to start hormone therapy? I also had blood clots at 49 from birth control pills. Well, Kathy, thank you for this question. What's your thoughts around this for Kathy in general?
No, it's not too late. No, it's not too late. I start with women all the time, and even in their mid-70s on it. And again, you're using a bioidentical, you're using a cream, you're not going to get blood clots from it. Certainly birth control pills. That's why you never take a progestin that's not micronized, and you don't take it orally. Birth control pills, you should not be on a birth control pill at age 49. And that's what most of the gynos do. When you go into menopause, either you need Prozac, you need a birth control pill to help control these symptoms. No, you do not need synthetic hormones for menopause.
Yeah.
You just don't, it's dangerous. Plus who knows, you may have the MTHFR gene. You should also be you're probably on an aspirin now, but I put men on a daily aspirin of 81 milligram at 40, women at 50. Sometimes earlier, depending on the risk factors, but I'm a big believer in low dose aspirin therapy. Very important.
Kathy, I hope that helps. Thank you for that question, because I know a lot of people are thinking the same thing.
Question.
Yeah, thank you so much for that. Real quick, I'm going to put this up from Julie. Thank you for this comment, Julie. We really appreciate this. We really appreciate you. And I put this up here because you mentioned our wonderful office staff. We have quite a few of our office staff in the building tonight. I just want to give a shout out to all of our team in all of the performance medicine offices. You guys are incredible. So Julie, thank you for putting this up here. Our staff is the absolute best. Thank you so much. Okay, let's keep moving here, guys. I think we are running out of time. So real quick for DC Cairo or D Cairo, Roman, are you familiar with Patrick Soon Xiang, a surgeon, scientist, inventor? He's also a medical doctor with expertise in areas like cancer research and immunotherapy. I
am. I've listened to a lot of his stuff. He's at UCLA, and he's a billionaire for one thing. But yeah, I've seen him on some of the bigger podcasts, and he has a lot of expertise in cancer research, and we have a lot of interesting. I have a lot of interesting thoughts about what he's doing, but I think he's on track. It's just, whether he gets his products to market, I don't know yet. I hope so, because he takes a totally different approach. Anybody that's not familiar with him, just Google him, and you'll get a 2-hour podcast on it. I don't know if it's on Rogan or where I heard him, but he is a smart guy. I like his theory on how, and he talks also a lot about COVID. He morphs into that a lot on some of his podcasts. He's not a big fan of the vaccine.
D Cairo, thank you so much. We're going to take this from Sam, then we're going to call it an evening. This is a great question from Sam. How to deal with very high stress. All the basic ideas I have already. Need something new. Real quick for Sam. Any kind of new outside the box things for stress?
What did Timothy Leary say? Drop in, drop out. He meant drop acid and then drop out of society.
Oh, man.
But don't do that.
Don't do that.
That was back in the 60s. Timothy Leary. Has anybody heard of him?
I did not get
I'm
that.
the oldest guy in the room.
I did not get it.
If anybody's heard of him, please give me a shout out, because
I didn't get it.
You had to
that
be
went
around.
That went way over my head.
You have to be. That was a famous saying back in the 60s. But there's nothing that beats. There's no better stress reducer than exercise. I find if you wear yourself out, you will sleep better, you'll worry less. And here's another thing I will tell you. If you listen to my podcast on forgiveness, here's a motto you can go by. Forget the past. Forgive everybody.
Ooh.
And if you have a high stress job, I mean, get out of it. Do something different. Life's too short to make yourself miserable. So do some kind of major change in your life. I mean, major change. I'm not talking about going on vacation, but exercise maximum every day. Make sure you're sleeping well. Practice forgiveness.
Oh yeah. Yeah.
It's hard to forgive yourself. You
Yeah.
have to receive forgiveness. As far as that goes, you can use some of the basic. I'm sure we do have a stress formula with ashwagandha, L-theanine, and saffron. I like it. Try not to get on some of the heavy hitter drugs like the benzos and all that.
Yeah.
It's just they don't work too well, I don't think. Short term maybe, but long term no. So life changes. I hope that helps.
Sam, I hope that helps, brother. Thank you for asking the question.
Oh, here's another good thing. I should have brought my True Vega thing up here.
Oh, yeah.
I do have a vagal nerve stimulator that I wish I'd demonstrated here, but it fits. It's a little $500 gadget that I bought to test it out. And you're activating. You put it on your neck, right where the vagal nerve runs down, and you'll know it when it hits it because you'll feel your ear buzzing and your jaw will drop down. Your right side of your lip will drop down a little bit, but you're activating your parasympathetic nerve, and it will immediately calm you down. It's better than deep breathing, which is another exercise when you're anxious.
Yeah. Nose breathing also helps me quite a bit when I'm feeling anxiety.
You can almost always calm yourself down with your own methodology, but mine is called a True Vega.
That's interesting.
It's a pretty interesting little gadget to activate that parasympathetic nervous system. But there's a ton of ways.
Yeah.
Acupuncture helps. We need to have Scott back on here.
Yeah, that's a great topic for Scott.
Great topic.
Sam, thank you so much. Guys, one thing I know I missed a ton of questions. Bless you. Bless you. Bless you. I know I missed a ton of questions. Amy, I see you. Thank you for being in here tonight. So quick ask, if I missed your question, and email me. Shoot me an email. I'll make sure it gets on the show next week. ben@performancemedicine.net. I'll respond tonight. Just tell me that I missed your question. I will get it on first next week. We're back Tuesday, 7 to 8 Eastern. We do this every single week, so we'll always be back. So I apologize for missing the questions. I saw so many come through that were amazing, and I really I hate that I missed some of them. So email me, ben@performancemedicine.net. I'd love to hear from you. And we're going to call it a show. Let me know in the comments how we did. I'm going to turn off the podcaster. I thought you did awesome.
I thought you did good. Does this mean I can lay down the microphone?
You can lay down the mic. Yeah.
Oh, we're still on air though?
We're on air, but we're gonna shut it down. Guys, we appreciate you. Doc, I appreciate you. Thank you. Guys, this is my dad. This is my dad. We get to do this together on Tuesdays at his house. This is amazing. We just had dinner before. Shout out to Brookhaven Farms. This is my
house with my guitars.
Yeah.
My workout room.
Yeah. And
my refrigerator.
We had Brookhaven Farms tonight. Shout out to Jake and the Brookhaven family.
Hamburger tonight.
They were amazing. They were amazing. April, I see you. I love you. Thank you for being here tonight. Such a great job in office. Thank you. All right, we're heading out. Love you guys. We will be back next week, Tuesday, 7 to 8. Let us know in the comments how we did. Thank you, Foxy, Moxie, D-Lan, Corey, Julie. Thank you so much. All right, we're heading out. Pop, go get you a bike ride.
Okay.
All right, let me see where my outro is, Brad. Where are we at?
Don't go away.